A continuing series of leadership videos. I'm here in Tampa Bay at Tampa Bay General, and I'm here with John Couris.
Hey.
John, good to see you.
How you doing? Good to see you.
We did a little traveling today to come over and see John. So John, tell us a little bit about yourself and Tampa General.
Well, I'm John, and I'm the president and CEO of Tampa General Hospital. Tampa General Hospital is part of a large family of businesses called Florida Health Sciences Center. We have about 130 locations across the state of Florida, close to about 14,000 team members, including our physicians and all of the partners that we have. I've been here for 5.5 years.
Right. Mm-hmm.
We've had a really good run, even through COVID. The team has done an exceptionally good job at responding to COVID and recovering from COVID. Mm-hmm. I've been in healthcare for over 30 years. I started in Boston at the Massachusetts General Hospital, then went to the Baycare Health System in Tampa, and then from Baycare went to Jupiter,
right,
where we met.
Right.
Mm-hmm. Where we met, and then I came back almost 6 years ago to Tampa to run Tampa General Hospital and Florida Health Sciences Center, and I really wanted to get back to academics.
Right.
And we have a robust relationship and partnership and are integrated with the University of South Florida, Morsani College of Medicine.
Right. And you can see that when you drive up to the campus. Their name is all over the campus too. So it's really good. It's a good combination.
It's a wonderful partnership.
So tell us a little bit about, getting personal, a little bit about your family and moving your family around, and I guess moving from Jupiter on the coast to the West Coast.
My daughter was not thrilled about the move. So I've got 2 children. I've got a 25-year-old son who actually lives in Miami in Brickell.
Oh, okay.
And I have a daughter who's up in Gainesville, and she's finishing her sophomore year, and she's living up there. When I moved her, though, she was a rising 10th grader. I don't advise moving 10th, 11th, and 12th graders. She was not thrilled about it. She was not thrilled about leaving South Florida and Palm Beach and Jupiter in particular. But we talk about it now. She's 22, just turned 22, in school. And she actually says she's glad she made the move. I mean, Tampa's a wonderful place.
Oh, absolutely, sure.
First of all, Palm Beach and where we lived and where she grew up is spectacular. The people are wonderful. The community's great. But Tampa's equally as good. Tampa's just a wonderful place to live. It's a wonderful place to run a business. It's a great place to raise a family, and it's exploding. I mean, the Tampa Bay market, both Tampa, the city, St. Petersburg, Clearwater, the surrounding areas of Tampa Bay are just absolutely exploding. So, but once we got through, she was not a happy camper, so it was a little tough. But once we got through all of that, she's really enjoyed it here. My son was already out of the house. He was already in college at Florida Atlantic University, and then ended up moving to Miami.
Yeah, well, that's, it's hard moving somebody who has a lot of friends at that age.
Very hard to move a 10th grader who's a girl who has a lot of friends. Yeah, no question.
So what surprises did you see when you moved from Jupiter, which was kind of a nice smaller community, to a city this size with the largest facility in the city? Well, I guess you expected, what did you see or expect that made it like the wow moment when you got here?
Well, Tampa General Hospital has always had a very good reputation across the state of Florida. What I found was an absolutely outstanding organization doing really good work. But the organization basically needed to go from good to great, and then kind of great to world class. And that's the journey that we've been on.
Right.
The wow moment for me was probably when I was here about a year, working with the university, working with our private practice physicians, and then realizing, in particular, working through the university, what incredible physician scientists we have at the university and at the medical center. And it dawned on me, I wasn't surprised because I moved here because I wanted to get back to academics. But what surprised me was just the richness of the content and the seriousness of the physicians. I mean, an example would be, I'll give you two. One is we have the 6th largest transplant program in the United States at Tampa General. That was built in the 70s by private practice physicians, which is an anomaly in our industry.
It is very much
It's usually driven by the university.
Correct.
This was driven by private practice doctors.
Wow.
So there's this like rich history and commitment to excellence. And the transplant program is a great example of that. Now we partner and collaborate with the university around transplant, and it's only made it better and stronger. But the origins of the program started with community doctors.
Wow.
At the same time, our neurosciences service line, or our neurosciences institute, is one of the largest neurosciences institutes in the country. Now, you wouldn't necessarily know that just to know it.
Right.
But when you look at the depth and breadth of the work that's being done, it is incredible. From basic science to clinical research to education to residencies to fellowships to the infrastructure that we have at the institution. We take care of the most complex and rare neurological diseses in the world here at TGH. And people come from all over the country, not just all over the state, to come here. I wasn't, like, I was surprised by the size of it.
Right.
And then we've been heavily investing in it over the last 4 or 5 years, so it's even bigger. But just so impressed. I mean, and those are just 2 examples.
Right.
There's 10, 15, 20 more examples like that I could share with you, but those are just 2. So my aha moments was that, wow, this is basically what I found was a diamond in the rough. And all we needed to do was dig it out, polish it up, and kind of get it out there. And that's what we've been doing.
And the support between the physicians and the staff has been wonderful, I guess.
The support between the physicians and the staff, the university and the medical center, has been absolutely outstanding.
Tell me, you, from what we're looking at, you're looking to, I know you opened up some medical offices on the East Coast.
I have, we have.
And looks like they're very successful also.
They've been very successful. The team has been doing an excellent job.
That's great. That's great. Just to show you why we're here today and bring it to South Florida, because John has brought some of the excellence to physicians into the Palm Beach area. So tell us, during your career, and you've had a long career, and I'm reading your bio just before I got here, starting out in Boston, coming around, what was some of the challenges you saw in your career? Again, from the standpoint of people who are watching this, would be entry-level people, students, mid-level, people looking to take your job one day. So what could you give them for that journey? What were some of the things that made you excel through that journey?
No, it's a really good question. It's really not complicated. But you have to be super disciplined and willing to do what I'm about to share. And if you do it, my opinion is, and if you'll be wildly successful. You'll do whatever you want. You'll accomplish anything you want to accomplish. I think the first thing is you have to be willing to work really hard.
Right.
There is absolutely no substitute for hard work. And I know that sounds like a cliche. It's not. Working hard and staying focused is critically important. Having the grit and determination to work through some of the most complex issues in healthcare, or operating issues in healthcare, policy issues in healthcare, is really hard work. And you have to, healthcare is very tough. It's tough because it's a highly regulated environment. It's a bit of an antiquated environment. And it's kind of a little bit, in some respects, like higher education, in the sense that people are very rooted in how things were done 10, 20, 30, 40 years ago, and sometimes unwilling to change.
Right, Sure, I've seen that many, many times.
Yeah, and so so what you need to be able to do is kind of punch through that work, and but that requires being tough mentally. That requires being gritty, right? Willing to really work hard and make no excuses about it. It also requires you to be willing to make some sacrifices.
Sure.
I've had to move my family a few times.
Right.
Right? Now, I didn't have to leave Boston, but I chose to leave Boston because I knew it was the right thing for my career and the right thing for my family. I didn't have to choose to leave Tampa, but I knew going to South Florida was the right thing for my family and the right thing for my career. I didn't have to come back to Tampa to run an academic medical center and a health system, but I did it again because it was the right thing for me and my family. But that comes with sacrifice because the older you get, the more you accumulate. You have kids, you have a wife or a husband. You get rooted in your community.
You got very comfortable.
You get comfortable,
right?
And you have to be willing to sacrifice, and that's hard to do. So if you work hard, if you're gritty and you're willing to grind through the tough work, if you're willing to sacrifice a little bit for your career, and really, quite frankly, if you do better, so does your family, right? If you're willing to sacrifice and make sacrifices, that sort of, and you're personally accountable for your work.
Sure.
And when you put all that together, you start to really see success.
Right.
That's what I did through my career. I mean, I started in my career, I was working in a nursing home in the summers as like an orderly, transporter, utility infielder of all sorts of things. And I fell in love with healthcare, worked my way through college, worked my way through graduate school, and sacrificed.
Right.
And didn't really make a lot of excuses. When I was at Mass General, for example, I would always say, I may not be the smartest person in the room, but I will outwork anyone. And that goes to this day. I'm 55 years old. I may not be the smartest individual in the room, but I will outwork any individual in that room all day long. That's been very helpful in my career. It's not, now, getting the right education, getting the right experiences, connecting with the right kind of people, and networking appropriately, those are all important. But there is no substitute for working hard, being gritty, being willing to sacrifice, etc.
Right. Well, I always tell people you have to have the right tools in your toolbox.
Yeah.
But you have to know how to use them.
Yeah,
you can have the right tools. I mean, and that's the education, that's the experience to be able to move forward.
Right. You have to have the right. You have to have the right tools in your toolbox. That's a really good way to say it.
Right.
Yes.
And the family. I mean, I know I did a lot in my career moving around, and your family has to be on board. I would assume that was one of the things you found.
Yeah, I'm very fortunate. I have had a wife, her name's Diane, who has been absolutely supportive on anything I've done or anything I wanted to do. She was and continues to be a positive influence, a supporter, a shoulder to cry on every once in a while when it would get a little frustrating, or if I wasn't sure I was making the right decisions on something. I was been blessed with having a great partner. That's critically important. Critically important.
What was the some of the moments? I guess you went through COVID here. When you moved, COVID was part of it. What was some of the learning parts of COVID? COVID was bad, but I found in talking to a lot of people that it really helped them see the right people that were able to step forward at the right time, getting systems in place where you didn't think it would happen and it did. Tell me a little bit about that, how you as an organization came through that with your staff and organization. And the other end, what made it better when you came out the other end?
Yeah, we did a couple things. So here's a couple of truths that I sort of stumbled upon and saw going through COVID. One, we have at the time, we had a very resilient workforce.
Sure.
People really stepped up. When people were running away from COVID, our team ran towards it. So it's sort of like the firemen not running away from the fire, but they're running towards the fire.
True first responders.
To put the fire out. True first responder mentality. I could not be more proud of the team at TGH and at USF. It was amazing to see them come together and to see them work and care for people that were sick and dying from COVID-19. The resiliency and the ability to run towards the crisis and the emergency was left me speechless. So that's one truth. The second is this industry that I'm in and that I've spent my career in can be very innovative when it wants to be and can move a lot faster than we typically move when we want to.
Sure.
That is a real learning lesson for all of us, or at least it should be for those that are in the industry and leading organizations in the industry. You should recognize we shouldn't have to have a global crisis to show how quick and innovative the industry can move when it comes to finding new and innovative ways to care for patients.
Right.
We should continue that. We should not lose that. We should capitalize on the fact that we've learned that when we needed to make quick decisions, we did. When we needed to build innovative solutions to problems, we did. When we had to create innovative therapies to take care of patients, particularly early on in COVID-19, we did. We innovated efficiently and effectively, and we moved fast. Big learning lesson, because healthcare, right or wrong, healthcare tends to get described as an antiquated, slow, bureaucratic system. We clearly showed that healthcare can pivot in times of crises. The question now becomes, how do we take what we've learned through the crises and make it part of the way we operate?
Better systems, that's right.
Right, better systems, more innovative work, move faster, make quicker decisions. That was a big learning lesson for me. The last thing I would share with you is sort of a part of our success, because we were getting patients from all four corners of the state of Florida coming in by our helicopter systems, ground transportation, people seeking our kind of care. It was tough. But what we did as an organization is we bifurcated the organization early on in the first 6 weeks. I basically said to the organization, I want a team of people focused on responding to COVID-19. So take care of sick people and save lives. Then I want a team of people who is focused on the recovery of COVID-19. I want people focused on our strategies, on our tactics, and I want people preparing us for when we come out the other side of COVID. And someone said to me, well, how do you know this is the right decision, John, that you're making for the organization? I said, I don't know completely if it's the right decision. I do know that the world is not going to come to a grinding halt because of COVID-19. I do know there's going to be another side to this. I don't know what it is, but we better be prepared for it and start thinking through all of that. So that's what the organization did. We bifurcated ourselves. It has been hugely successful for us. So when we look at today, for example, when we look at our volumes and our activity, we are way ahead of pre-COVID numbers, way ahead, number one. Number two, we never lost money through COVID-19, ever. And I mean, take out the money that the government gave us for a period of time. Remember, we had to pay all that back. There was this urban legend that people thought that healthcare was getting rich on COVID-19.
Right, absolutely.
We were not. Net for us, COVID-19 had a little over $100 million impact on my organization. We never once lost money. We were able to respond and recover simultaneously. I didn't realize how well it was going to work at the time. It worked really well. That's another thing I learned. Is again, it kind of ties into innovation and resiliency. But that's why TGH and USF did so well.
Right. You were, excuse me, you were a leader, I remember back, and going off script now, back at Jupiter. And we had I remember having an event there with IBM Watson.
Yeah.
Okay, you were an early adopter.
We were
real early adopter of AI, okay,
Yeah.
within healthcare. How do you look at that today?
Well, I think you learn more from your failures than your successes. I mean, you do. First of all, I applaud IBM, and I still applaud
Right.
IBM for trying to tackle the most complicated issues
Right.
in healthcare through Watson.
Right.
And could they have done some things differently? I probably. Were they overly ambitious? Maybe. But were they looking at really deep issues and trying to solve those deep issues in our industry using AI? They absolutely were, and I applauded them for it. I wish they didn't get rid of IBM Watson, particularly the healthcare module.
Right.
I think they were onto something. I think they should have kept going.
They were way ahead of the game.
They were way ahead of the game. They had let me tell you, the people we met, and when Ginny Rometty was still chairman, we spent 2 days with her and her entire team and their scientists. They are the real deal, okay? Period. Now, do I think they were a little too ahead of the game? Maybe. And like I said a moment ago, do I think maybe they could have been a little too ambitious? Maybe. But I think they were spot on. What I saw through that experience was what the future could look like using AI appropriately.
Which a lot of people could not see that, because if they didn't experience it, they couldn't see it.
I mean, we were way out ahead of AI before it was even talked about. And what that did is it propelled us, when I came to Tampa, to really get out ahead of using AI and predictive analytics to drive healthcare forward. And that's what we've been doing at TGH. If you went up on a second floor of one of our facilities here, there's an 8,000 square foot center that's run on artificial intelligence and predictive analytics that drives improvements in efficiency and effectiveness as well as quality. And if we have a few minutes, we should run up there.
Sure.
I'll bring you up there
Absolutely.
real quick, take a look at it. So yeah, I mean, I have no regrets working with IBM.
Yeah. But it was a good launch, and I still
it was a
remember that.
wonderful launch. I wish they stayed with it.
Right, yeah. It was and that was a time when really nobody else was doing anything. Nobody else was doing anything.
IBM is a wonderful organization. Right. It's one of the many American-born organizations that helped define America as being what we are today when it comes to industry.
Right. Yeah, it's a shame, but it did open up everybody's eyes before it was even thought about.
I was been very impressed with them.
To kind of wrap up, what if you're a young person getting into, and you mentioned it earlier, but what was the one thing that you find that, I guess, and you have your own children, so you understand that maybe even a little bit more, that some of the younger generation doesn't do that they should do in a career, either in healthcare or something else? I mean, you're very successful of where you are today and what you've come through. And a lot of people say, well, maybe that was easy, and it's not easy. But what do you do?
No, it's not easy.
What do you do to be able to make that happen?
So my advice to the next generation: be patient. So I'm not a big believer. You know how when we were growing up, you'd hear from your parents and grandparents. Well, my generation, we did it this way.
Right.
Your generation, you don't know how to work hard, and you don't know how to sacrifice like we sacrifice.
We walked 10 miles in the snow to get to school.
Growing up, you heard that.
Yeah,
Every
right.
generation, in some form or fashion, passes that down. I don't think that's the case. I think the younger generation, they work hard, they're smart, they're well-intentioned, they're gonna be successful. One thing I've noticed, though, is they lack patience. They lack patience primarily, in my opinion, because of the internet, because
Right.
of Instagram and TikTok.
Everything is instant.
Everything's instant.
Right.
Everything's instant. I mean, I am less patient today than I was 15 or 20
Right.
years ago, because when I want something to buy something or to see something or to get information, I can get it instantaneously.
Right.
What I think happens with the younger generation is they don't know any better. They think everything should work like that. My career should be fast.
That's right.
If I want a promotion, I should get a promotion.
If I want to be the CEO of the hospital, it should happen tomorrow.
It should happen tomorrow. If I want more money, I should get more money.
Right.
Do they understand the power of patience, sacrifice? That's the question I would have for them. Because my children, I am blessed. Every parent thinks their kids are the best. My kids are really the best. No. My kids I'm really impressed with, because one of the things they have is they're gritty. They know how to work hard.
Sure.
They do. My son knows how to sacrifice and knows how to work hard. He's starting his own business and he's starting to see some success.
Good.
Just starting. My daughter knows how to sacrifice because she was challenged through high school. You know, learning didn't come easy, but she worked through it. She realized that going to junior college was the better path for her, so she worked through it. She now got accepted to the University of Florida, one of the best universities in the country. She's achieved that. Well, she's done that.
But she knew how to get there.
She's right. She's done that because she knows how to work hard.
Right.
So does the younger generation know how to work hard? They do. Do they know how to sacrifice? They do. They define working hard and sacrificing differently than my generation, but they know how to do it, and I'm impressed with that. What they don't have is patience.
Interesting. Yeah.
They don't. They want everything now, and that is not how the world works. Even in today's digital age, when you're in a company or you're building a business or you're creating something, it takes patience, hard work, focus, and discipline. They have most of it, but what I do notice is there's a lack of patience.
Interesting.
So I would encourage people to think about ways to be patient. And by the way, for the person listening to this from the younger generation that says, well, I'm not going to wait around 10 years to achieve what I think I can do in a year, sooner, I'm not asking you to do that. But what happens a lot is you'll hire somebody that might be like a younger generation. Right. They'll get the job today. 6 months from now, they'll want to know when they're getting promoted.
Right.
I'm like, well, wait a minute. You haven't done anything yet.
You're just in the learning curve.
You literally haven't done anything yet.
Right.
I mean, that's what happens sometimes. And you're like, what do you mean promoted? Well, I'm ready for the next thing. But you haven't done this thing yet. Like, shouldn't you accomplish some things first before we can determine whether or not you should be promoted? That would be my advice. Work on patience. You don't have to give up a lot for that, but you have to be reasonable in your career trajectory and timing, if that makes any sense.
The timeline is not what you think it is. So.
No, the timeline is definitely not what you think it is.
Yeah. John, I appreciate your time. I know you're a busy guy,
well, I appreciate
and you
it.
have a lot to take care of here. And I'm glad I came over to see you. And we will do this again maybe in about another 6 months just to catch up.
Sure. This was great. Thanks for coming.
Thank you.
Yeah,
Thanks, John.
Thank you.